during a facelift, technically the skin is not the most important structure to work on. A lot of the important stuff is done on the inside of the face, right? And it's mass, platysma, treating the jowls, giving volume, right, with the fat transfer. The skin acts as a cover. Now, the better the skin, the better the results, regardless of the type of work we do on the inside. And it makes a lot of sense, right? Now, you're in your mid-60s, and you told me you did the baby oil, right?
Burns,
you did that. It was common in the 90s, right? Common in the 90s. And it wasn't popular for people to do sunscreen. I have kids, 3 kids, and even at this age, sunscreen whenever they leave the house or they go down the park and play, right? My parents did not do this to me growing up. So that's why by the time the patient needs a facelift, there has been some damage, a significant damage done on the skin. So by the time the patient develops jowls, platysma bands, and loss of volume, there has been a significant damage done on the skin, and this is what sometimes is a limitation to the potential results that we can achieve. Now, the beauty of the skin, though, and it's absolutely amazing, and we have learned this in burn victims, right? Burn victims who need skin grafts. The moment we lift the skin off the body, a couple of processes happen. Something called primary contracture, something called secondary contracture. It tightens. So that's why I always say the best skin tightening procedure is a facelift. Why? We know it for a fact. So the moment we lift the skin off the body or off the smash, there's a primary contraction mechanism happening in the skin. And then over time, a few months down the road, a secondary contracture mechanism starts happening. So the skin keeps on tightening a little bit. And that's the maximum we can do. Now, what we are going to do, obviously, we're going to continue your skincare after the procedure. A few weeks down the road, we're going to restart the retin A, vitamin C serum in the morning, and maybe next year we'll do a little treatment, a little laser, a little something. Today we're going to do the laser, we're going to do the Eve lift, we're going to do the volume with the fat. And for the skin, we're going to do the maximum treatment we can do. That's a laser, stem cells, supercharged stem cells with PRP, activated PRP. So we're going to take your own blood. We're going to get the platelets. We're going to activate the platelets. It's very important to activate the platelets, because if you just inject the PRP without activating the platelets, they're sitting right there doing nothing. This, in my opinion, at least. So we activate the platelets. We do a CO2 mask. We do a lot of things for your skin today, but that's one treatment. And you should never expect one treatment to do something. So it will do something as a boost, but it's not going to be like a magic treatment, right? So it's like going to the gym for one day and expect to have 6 packs, right? So we gotta give it time. We gotta be consistent. There's a lot of legwork to be done. So today we're gonna do the procedure. Today we're gonna eliminate the jowls, get the platysma bands together, remove the loose skin, get the volume needed, give one booster treatment for the skin. And then down the road, we're gonna continue working together, right? To achieve a better skin. And the important part is we have tested your hormones, we have tested your toxin exposure, and Dr. Labib is gonna follow up with you to optimize the levels of all of these little things. Okay?
Okay.
Ready?